Two of the country's largest DHBs have told Checkpoint they're struggling to reach budget targets for the financial year, with a Waikato board member telling us staff are being told to find savings they can't possibly achieve. And Auckland's DHB chairman, Levy, has told us making ends meet is becoming very challenging, and they're now considering the consequences of the steps they need to take in order to achieve a no budget deficit. Now, all of this, of course, follows weeks of investigations by Checkpoint into DHBs in crisis. But Waikato and Auckland aren't in that category. Auckland has been celebrated for its ability to come in on budget for years, and Waikato was cited on Checkpoint last week as addressing its deficit, even down to zero. But one board member, who we're beginning with, wants to know how they're going to get it down from the level he thinks it's actually sitting at.
Look, it's $32.5 million. That's what we've been told. We have asked our management to go away and see what savings could be made.
That's Dave McPherson, Waikato DHB board member. As you heard, its initial projection, a $32.5 million deficit for the 17-18 year. But that was deemed too much, so they're currently looking for savings. So what kind of pressure do you and the board feel under to make these savings?
Well, I think we're being used as pawns in the election at the moment.
What does he mean? Put simply, as the Canterbury and Southern DHBs get headline after headline for the pressure they're under, Waikato is shaping up to be that most valuable DHB in election year, one that can come in on budget. Here's their chairman, Bob Simcock, on Checkpoint last Thursday.
Our intention is to deliver a break-even budget to the government. Clearly, our initial work through the budget identifies significant pressures, but we will be presenting a break-even budget.
That's their intention, but as Bob Simcock told our producer Bridget Burke, their original projection was that deficit.
32, I think, would have been the figure.
When the DHB showed an initial deficit of $32 million, what was Ministry of Health's instruction to you?
I wouldn't take it as an instruction. There was a clear indication that we're expected to meet our normal obligations, which is to live within our means.
And so admirable was the chairman's intention that the minister picked up on it an hour later.
Bob Simcock, the chair of Waikato DHB, was on your show an hour ago saying, well, they started with a large deficit. You chip away at it over time. You look at how you can, deal with some of these back office functions, continue to focus on providing the frontline services at the same time as reversing a deficit. I mean, this year, the Waikato DHB is actually going to be in surplus.
Jonathan Coleman on Checkpoint last Thursday night. DHB staff and other board members were listening, and some were aghast. They've contacted us, but Dave McPherson was prepared to speak on the record and on air.
So there's quite a bit of political pressure coming on us. The reality is that our staff are being told to find savings that they just can't possibly achieve. So that puts pressure on them, which then puts pressure on us. And we're having arguments, quite literally, within our board about whether we should put in a budget that's a hope or put in a budget that's a reality. And that's the sort of argument we're having on our board at the moment.
And are you under pressure, do you think, at a political level and or a ministry level to effectively put in a budget that's a hope?
Yes, absolutely.
Now, Dave McPherson can understand the pressure the Waikato DHB is under to do that, but
my view is that we're being irresponsible if we're putting in a budget where we can't actually demonstrate and prove, if you like, that we can achieve savings. I didn't get elected to a board to be told to sort of pass a budget that was just hopeful.
Of course, this kind of toing and froing, hunting for efficiencies in the back rooms the minister talked about, is standard procedure. But the thing Dave McPherson is most bewildered by is that a $32.5 million deficit has suddenly somehow been reduced to zero without the required savings even having been agreed to.
I was quite annoyed to hear the minister sort of glibly say that we'd get back from $32.5 million. We haven't even had the meeting of the board to discuss this yet, and it's not scheduled for another 3 or 4 weeks.
Dave McPherson in Waikato, where they're, quote, arguing about whether they can achieve the savings required. We wanted to see break-even without argument, without pressure, so we went north.
The number one issue is And the number one risk is, how do you keep people safe? And how do you do that while you're trying to balance all these issues about productivity targets, financial targets, and the like? And it's quite a tough ask at the moment. I must say that Auckland's a $2 billion revenue organisation per year, and when you're trying to land that on a no-deficit budget, it's often a bit of a white-knuckle ride in the last few weeks of the year.
That's Lester Levy, who has not turned his back on years of reliably getting the job done in a fashion that usually left the boat unrocked, but who finds himself patrolling the increasingly difficult intersection of health's supply and demand.
So, it's very challenging times.
Why? We'll return to Auckland shortly, but let's head to Wellington, where an internal Capital and Coast DHB paper prepared for the board and endorsed by its CEO puts it very plainly indeed.
The DHB is facing significant financial pressures and has been challenged over a long period of time to achieve better financial outcomes.
That was in May in Wellington, our third largest city. In July, in our second largest city, the Canterbury DHB warned that addressing its financial pressures may force it to make
significant service cuts of unprecedented scale.
And back in our largest city, Auckland, after a long, tough winter in terms of patient demand, arguably the fiscally safest board chair in the health sector is speaking like this.
I have been very clear with my chief executives during times such as that. They should have a very low threshold for deprioritising targets and for letting the budget take a hit if it has to, because in those kind of situations we have to make safety trump over everything else. But it's been very, very challenging and quite difficult, and realistically I have been concerned and I have expressed that concern.
Who to?
To the Minister.
We asked Lester Levy for an interview because we'd mostly been hearing from DHBs in crisis, Southern and Canterbury in particular, places where the stretch had become a snap. We wanted a different perspective, so we went to a chairman who likes his balance sheets written in black.
We've managed to have no deficits in the time that I've been there.
Which is a record Lester Levy's proud of. But we'd paused him at the end of that sentence, so let's hear how he continued.
But it has got more difficult, and I'll explain this to you in this way. 6-7 years ago, we used to rate the savings programs that we were required to make in order to meet the financial targets as whether there was a low risk of making it, that is pretty easy to do, or a moderate risk or a high risk. And they were all pretty easy to do in those days, and they were more around efficiency and waste reduction. And so therefore they had no real consequences in the organisation other than making it more effective and using our funding, taxpayer funding, more effectively. Slowly but surely, over the years, they've become harder to achieve, and I guess that makes sense because you're starting to squeeze the inefficiency out of the organisation. Just remembering these are complex, multi-layered organisations. But I'd say it is different because it has become much tougher, and this year is difficult and very challenging. We aren't quite there yet, so we are aiming to return a no-deficit budget, but right at the moment we're looking at the consequences of the steps we would need to take in order to do that.
Lester Levy doesn't often talk like that in public. So, the costs that can be cut have been. Winter has been tough. Population-based funding hasn't always kept up with Auckland's rapidly growing population. And now a DHB that's not in crisis is starting to face the same kinds of choices as those that very publicly are.
And whilst clearly somebody like myself reports to the Minister of Health, and we have obligations to the Minister and to the Ministry, we owe our duty of care to our population and our staff, our population for safe services and effective access, and our staff for their well-being. And I think we're getting to the point where that is being challenged, and I've been pretty frank and open about this.
That's Lester Levy. We'll return to him and to Auckland shortly. But what does the Minister want of his DHB board chairs? A letter dated 16th of December last year offers some answers.
Letter of Expectations for DHBs and Subsidiary Entities 2017-18.
This one was addressed to Bob Simcock, the chair of the Waikato DHB, although we didn't obtain it from him or from his office. It contains a section entitled, in bold,
Living Within Our Means.
And it's very explicit indeed.
DHBs need to budget and operate within allocated funding and have clear plans to improve year-on-year financial performance.
Signed, Jonathan Coleman, Health Minister. It continues.
You and your board must monitor and hold your chief executive accountable against these expectations.
And how does the Minister suggest the board do this? He's very clear. He expects them to, quote,
make efficiency gains.
Which brings us back to Dave McPherson on the board of the Waikato DHB. He hadn't seen that letter, so I read that part to him. And in it he says that he has absolutely no doubt the board will continue to make efficiency gains to ensure better performance. Can you make efficiency gains without endangering patient care?
No, I don't believe we can. We've struggled right through the year to try and break even, which in a financial sense we did. At the same time, John, Waikato DHB has got the highest number of emergency department presentations of any DHB in the whole country, and that sort of figure has been getting slowly but steadily worse during the year. And that's one of the sorts of effects. We can't fund GPs enough for people to be able to afford their care, so they wait until the situation gets dire, and then they come into the emergency department. Huge pressure on that department in our hospital, and the rest of the hospital is not able to help them enough to sort of get people to flow through, if you like, from ED through into the specialist care areas that they need. It's that's putting massive pressure on patients and staff, and I think it's going to break soon if it keeps going like that.
That is Dave McPherson, who is on the Waikato DHB board. Now, the board chair is Bob Simcock. He was unavailable to appear on Checkpoint tonight. Lester Levy raises a fascinating point about population-based funding. So that is set as a projection. But, of course, Auckland in particular has a very, very fast-growing population, which means that DHBs often end up with way less money than there are people in their catchment area. That is a subject we will return to at a later date.